we're finally in the Western medical model, because I do work in a Western setting, one of them, and they're beginning to embrace trauma-informed healthcare, which is getting to know it's very funny. It's after 18 years, we figured out that trauma-informed healthcare is important to the care of our clients. I'm like, well, 3,000 years ago, the Chinese figured that out, but
You would have to do repeatedly to start seeing beneficial changes.
ideally, if you're coming to acupuncture, Chinese medicine, anything holistic, you want to start before you get a bad condition. Ironically, what always shows up in my office is somebody who's been through everything and nothing else has worked. And that is theoretically the least effective time, but it's actually effective where I can work with people. Now, if you've waited 10 to 20 years with your problem, it's not going to go away in one or two treatments, and you may need some maintenance treatments for a while. You may need to come monthly or every couple of months, whatever, to maintain. And there's work you have to do. If you do your work, it makes my work easier, and then you don't have to come as much. And your work may be stretching or exercising or changing body positions or eating better, all of which would be part of the conversation.
Welcome to American Gypsy Podcast. I'm your host, Gypsy, and today I have a special guest, Dr. David Paton. He is an acupuncturist, health coach, and founder of Starting Point Acupuncture and Health Services. Welcome to the show.
Thank you.
Can you give us a little background on, how you got started and what made you specialize in what you do today?
Sure. I was actually in Western medicine. I was a respiratory therapist working in a variety of settings. I was working in a pediatrics intensive care unit setting, and I caught a disease from one of the kids, and I got sick, ironically, with a respiratory infection. I knew I was getting bad, and I kept trying to treat it with what I knew to do, and it wasn't working. So eventually, one of my colleagues said, your other conversations, you talk about, Chinese philosophy and martial arts, and you sound like my acupuncturist. You should go to her. So I went the first time, and I walked out going, nah, this stuff's not real. And then about 2 or 3 months later, I was really sick and I was not getting better. And so I said, well, what the heck, throw the dice. Nothing else is working. And I was better within 2 to 3 months. And about a year and a half later, I was in school to study it. And that was back in 1989, 1990. So that's how I got into acupuncture. I was interested in Chinese philosophy and theory and the Tao Te Ching and all those things, arts. So it sort of dovetailed with my personal interests. And then as I got better in other areas, not just my lungs, but me, I began to see the value of looking at a person in a holistic manner as opposed to like the lungs, the heart, the kidneys, all the specializations. And also treating people to prevent that from developing as much as possible. And then that led to a master's degree, a doctorate degree. I've been in the field about 35 years now, 33. And, specializing in sports medicine. I've done some pediatrics. I did a research project on autism. It's sports medicine. So a variety of things have piqued my interest over.
What made
Now I'm in, go ahead.
Oh, sorry, I didn't mean to interrupt.
That's sorry.
I was going to say, what made you change your mind? You said that first treatment with acupuncture didn't really work. What made you go back?
Well, I didn't get treated. I met her and talked to her, and I thought this stuff's goofy. It doesn't fit with my model of Western med. I was 28, 29 years old. I was very much only experienced with Western medicine. So when I went to talk to her, I'm like, this is a stretch for me. I'm from the Midwest. I'm like, nah, it didn't make sense. And so it took desperation for me to go. And that then changed my life.
What are some common symptoms that you can treat with acupuncture?
Well, the most common one, obviously, is pain. Everybody thinks of us as pain management or dealing with neck problems, back problems, headache. And that's pretty well clear that information is accurate. It works. We've known that for 20, 30, 40 years. The more extended version of it is to really look at it and say, it actually is part of a whole medicine theory of Chinese medicine. So it deals with everything from asthma to psoriasis to I treated a child with juvenile psoriasis, which was extremely severe. I've treated autistic children. I've treated people with just emotional stress issues. And then I've worked in rehab environments and with sports athletes. So it really is that it covers a wide range of things it can cover, but it's predominantly still viewed as pain.
And I know you also do like cupping and
Mm-hmm.
I forgot what the other gua sha or something.
Gua Sha.
Gua sha, okay. How are those treatment different from acupuncture, and how does a patient know, what they need when?
Good question. Acupuncture, they're all part of Chinese medicine. Gua Sha is something that you can do at home. It's actually a home remedy in most Chinese households, Asian households. You can do it with a spoon. You don't have to have special instruments. That can be taught to somebody. And basically, what that does is it's a surface. It's almost like a massage where you're kind of scraping the surface with a dull object to get the soft tissue underneath to loosen up and to free up the capillary beds to allow the blood to come to the surface to release the stuck muscle tissue and fascia. Cupping is very similar. It just uses suction and a vacuum to do it instead of the scraping. Acupuncture actually goes below the surface and can be just below the skin or into the muscle fibers itself. Really get the muscle fibers to release. The scraping and the cupping will pull everything up to the surface and pull on the tension and release the blood flow. But acupuncture itself actually goes into the flesh, the knot, if you will, if there's a pain, and releases it from that perspective and creates movement. All we're doing really is creating movement where things are stuck.
And with any of these things, is it something that you would have to do repeatedly to start seeing beneficial changes?
Again, that's a great question because everybody asks that. Ideally, if you're coming to acupuncture, Chinese medicine, anything holistic, you want to start before you get a bad condition.
Mm.
Ironically, what always shows up in my office is somebody who's been through everything and nothing else has worked. And that is theoretically the least effective time, but it's actually effective where I can work with people. Now, if you've waited 10 to 20 years with your problem, it's not going to go away in one or two treatments, and you may need some maintenance treatments for a while. You may need to come monthly or every couple of months, whatever, um, to maintain. And there's work you have to do. If you do your work, it makes my work easier, and then you don't have to come as much. And your work may be stretching or exercising or changing body positions or eating better, all of which would be part of the conversation. But acupuncture itself can be effective in an acute condition immediately. In a chronic condition, it can take weeks, months. It depends on how long you've had the condition.
Now, I know a lot of people, when they think of acupuncture, I kind of also think of, they compare it to chiropractor. And I've also been like, have had people recommend acupuncture to me when I'm going to a chiropractor. Are
Mm-hmm.
those, is one a replacement for the other, or how are they different?
Um, Actually, I like to work with chiropractors when they stay in their lane and I stay in mine. I'm trained in tissue manipulation, which I don't do because I don't do it often. And dry needling is not the same as acupuncture, and acupuncture is a little more effective. But chiropractors, I look at it this way: that both of us affect structure and function, anatomy and physiology. Their effects are more through affecting the structure, which is the adjustments and stretching ligaments. So they're affecting structure and trying to regain balance. And acupuncture working on a physiological level is trying to make sure everything functions properly. So if things aren't functioning and you go to a chiropractor and get a manipulation, it may not hold because you have an improper functioning system. On the other hand, if you have a functional problem, like say someone has lordosis, severe scoliosis, if they don't get that work done, my work's not going to hold much because the structure actually is causing the imbalance, not something else. So you have to identify which thing is causing the problem. I have at least one person with tingling in her fingers. And I looked at her x-ray and she's got major damage at cervical 4 and 5. That's not something I can correct. So that's a referral, not in her case to a chiropractor, but maybe to a ortho surgeon or somebody who will work on that area of her body, and maybe she needs surgical intervention to help keep it and stabilize it. That all depends on her and her doctor's conversation. But chiropractic, for me, is most effective when I'm working with them, when they address the structural person structurally aligned to the best that they can. And then I work with the chiropractor to make sure that the function stays after the adjustment. Does that answer your question?
Yeah. Thank you for explaining the difference between them. Do you feel like there are things that patients can do, whether it's lifestyle changes or, nutritional changes that can enhance or assist the treatment that you're offering them?
Absolutely. A key piece to there's 3 areas that Asian medicine that I studied and other holistic traditions. There are 3 things that are usually precursors to most diseases or conditions. First one is emotional stress that you do not deal with. So stress, which we're beginning to learn post-COVID, and we're really beginning to study it, and people are talking about it since COVID, but stress creates all kinds of hormonal imbalances in the body, which then affects the functioning of the organs. So you can be under stress and not even know it because you've adapted to it. That's the life that you. So acupuncture can help reduce that stress. Then addressing the issues that you call stress. Stress is just an umbrella label. So is it an emotional problem with a relationship? Is it a work problem where you're stressed at work because someone's not giving you freedom or you're overworked? So that's one level. That's the kind of emotional level. If people work on that, they can get healthier. And my patients have. I've actually seen physiologic changes in liver enzymes when people change their relationship to their work environment. The next piece is, diet's very important. If you don't eat well, the energy that I work, which we call Qi, is made up of food, air, and water. So if you're drinking Mountain Dews and Monster drinks and you're eating donuts, you're not going to have healthy energy and a healthy body. I mean, that makes common sense. So if you want me to be more effective, you will eat 3 times a day at least. You might have meals in between, but you'll keep your blood sugar even and you'll eat proper foods. Sure, that's a very important part. And then the last part is movement and exercise. If you're stationary and you don't go anywhere and you sit on a couch, your body's not going to function well. So if you don't get coached in those 3 areas, the likelihood of you getting better goes down. And if you do get coached in those areas and take the coaching, your likelihood of being self-sustaining in your health goes way.
Are there any potential risks or side effects that you've witnessed in this treatment?
Not generally. I haven't had any, and the CDC doesn't rate it as a high risk level for anything from infections on up. The oddest thing I had happen was early on in my career. I was working in a methadone maintenance center, and I was treating somebody who wasn't on methadone but was one of the workers there. She was quitting smoking, and she came in. She goes, "I'm feeling really, everybody uses the word stressed. I'm really stressed out." And I'm like, okay. So I took, her pulses to our measurements that we do, and I'm like, okay, I'll do this treatment on her to reduce that level of excitability that she had. And I didn't ask the proper questions, or actually the students that were bringing her in didn't ask the proper questions, because you want to look at, like, have they eaten today? If they haven't eaten today, they're running on adrenaline. I don't want to try to relax that, because then the person will fall out because there's nothing propped up. So it turned out in her quest to stop smoking, she was taking the nicotine patches. She had like tripled her nicotine patches. Not only that, but she actually had a cigarette or 2. And then she hadn't eaten in the morning. So everything I felt that was excessive energy was a result of nicotine. And when I calmed her down and relaxed it and like activated the parasympathetic nervous system as opposed to the sympathetic, rest and repose, she just kind of slid out of her chair because she had no real energy. She had no food. She wasn't exercising. She didn't have good air. And because of all of that, when I actually came along and diffused some of the tension in her nervous system, that was what was keeping her up. So that was a remarkable moment. I never made that mistake again. I always ask, did you eat today? If I feel something funky on your pulses or your diagnostics, I'm going to ask you, did you just have an emotional incident? Were you rushing to get in here? Because sometimes the abnormalities that we feel are really as a result of something that's just happened, and you want to wait and let that settle down before you think of it as a problem.
What are like some of the misconceptions or fears that patients, when they're first coming to you, what are some of their common fears? Because I know with personally, acupuncture always scared me. I know there's a lot of benefits to it, but the
Yeah,
whole a bunch of needles
you know,
going to my body,
right,
just, I just think pain. So what
right.
are some common fears that people have and how
Well,
do you?
that's the first and the biggest one, actually. Is it going to hurt? They always ask me that, and I always tell my clients this: if I'm going to put a needle in you, and a needle for an acupuncturist is the thickness of a hair. You can actually fit 10 or 20 of them inside of a regular syringe in the lumen of it. They're so small that it's really a fiber, not a needle. But because we use the word needles, people think of hypodermics. So the first question they'll ask is it going to hurt? Well, I'm not going to tell you no, and I'm not going to just flat out tell you yes, because if I tell you no and it does hurt, then you lose trust in me. And if I say yes, then you won't let me put a needle in. So what I say to people is that generally speaking, I can put needles in people and they'll go, "Oh, I didn't feel it." I'm like, exactly. And there may be some points that you do get a sensation. And actually, if I'm doing my job correctly, you should have a sensation from the needling, but it shouldn't be the sharp stabbing pain that we think of getting stuck with something or getting cut. It's a different sensation. It's got a name. It's called dachi. And dachi is a sensation of the needle coming in contact basically with your innate energy. And you should feel it, and I should feel it, and that would be ideal. Some people describe it as painful. Most people don't. It's so different. It's dull. It's achy. It's different. So that would be the number one. Number two is people want a quick fix. They think, that I could put needles in them, and then 2 or 3 treatments later, they don't ever have to come back, and they don't have to do anything else. And it's like that's a misnomer. Um, the other one is this has a lot to do with the difference between, say, physical therapy, dry needling, and acupuncture. Is that dry needling people will say that we don't tend to go deeper than superficial level, and that's not true. We're trained to go superficially. We're trained to go into the deep muscle tissue. Athletes are going to want that more than, say, a senior. If I'm treating a senior, I'm not going to go as aggressively. So we can treat deep. We can treat superficially, and then cost is one that people bring up. Ironically, a lot of times it's not covered, and in a day and age when everybody has to have healthcare insurance, that's problematic. Other than that, it's length of time and does it hurt are the two big questions. The
Yeah.
funniest one is when I get, does it hurt from people who have multiple tattoos? I'm
Yeah,
like,
that is
your
weird.
whole body's covered with art and color, and you're worried about an acupuncture needle. I'm like, and then honest to God, that's happened. It's like, really? Okay, you're scared of this tiny, tiny little thread, and you've had, zippers up and down your body and Singer sewing machine method. I'm like, no, no. Yeah, that's the funniest one.
Yeah. Are there any success stories that stand out to you that you're willing to share?
Sure, I have a number of them. I think one of the most profound ones, two of them were with children. I'm in Baltimore, and I did a study with Autism Speaks. They funded it, and wrote it with Kennedy Krieger Institute, a major institute. I don't know where you're located. It's a major institute in Maryland that treats it nationally and internationally, and it's known for its autism treatments. And we had to fight to get the study done, but we got it done. And with autistic children, the first question was, will they take the needles? They did. The second question was, will it be effective for them? And we did parameters that were measured in school systems by all of the people that they get. And so over 6 months, we noticed changes in language. Their spoken language went up. Their ability to understand information went up. Their maladaptive behaviors went down, and all of that's in a study that, if you look up my last name, you can find it on PubMed. It was published in 2017, and it was a small study, so it's not influential in that it doesn't have thousands of cases. But we did 10 children. Every single one of them took the acupuncture. Every single one of them came running into my office and jumped on the table and let me do the work. And that was witnessed by the sponsor of it, who was an OT, who ran the vice chair of the clinic there. And it was all done privately in my office. And so, that was one. Then there was the pediatric eczema patient who I really hadn't treated that for, very severe. She had to bandage up her hands and everything, um, because she would scratch all night long and claw, and it was really, really bad. And I treated her, and within about a year, she was off most of her meds, and her condition was clearing. And about puberty in Chinese medicine, that's when other changes occurred. She was getting healthy, and I really haven't seen her since then. She's got, under control. So about 12, I think, or 13 years old, she didn't really need my services anymore. She was doing pretty well. And if you do your job right, they sort of fade out and take care of themselves. And then recently I had a patient who was an overworker, overachiever, type A person, and her liver enzymes were going up. And I was working with her, and they were putting her on medicines which were supposed to correct it, but actually made it worse. And so finally, I convinced her to come out of her 60-hour-a-week job, go to her retirement, relax a little bit, treated her. And she comes in, she goes, numbers are below normal now, and I'm off all the meds, and the doctors keep wanting to treat me. And I'm like, well, yeah, I mean, it's your choice now. You can be on those things or not, but you were causing it because of the stress you were putting on your body by the hours you were working. And that's one of the three major diagnostic tools: emotions, overwork, and poor diet. She was doing all three. So we got her to kind of pay attention. One of the books I want to write is, When God Whispers, Do You Listen? And, do you listen early, or do you wait till he shouts? Like, shouting is putting you into a really chronic disease. Whisper is like, I don't feel right. And it's like, yeah, listen to the whisper and you won't get sick, generally.
Yeah,
So those are three cases.
thank you for sharing those, because I didn't, especially the first two, it's like I did not think you can treat autism with acupuncture. It seems very
Well,
unrelated.
that's the whole medicine idea, is that actually Chinese medicine, Asian medicine, holistic medicines are not just these simple procedures. That's what the best way. It's not a procedure. It has a process to it. Yes, there's a procedure, inserting the needle, but you have a whole diagnostic queue. You have a whole treatment planning queue. You have a whole individual, like, what caused this person's problems. And there may be similar things between people, but no two people same causes of disease. If I ask 5 people how they're feeling, oh, I'm stressed out, tell me what is stressing you out. I'll have 5 different answers. Oh, my relationship. Oh, I've got the stomach ache. Oh, I've got this. And it's like, so you have to deal with people as individuals, not as like an entity. Like, they did a study in China diagnosing ulcers, and doctors came up with peptic ulcer disease and gave them the same medicine. 25 patients. They had 25 different diagnoses in China for each person, because each person's ulcer came from a different cause. It's a very complex system, and it's simple as well. It's nature based. So all you have to do is go, look outside. If anything I tell you doesn't match up with what happens out in nature, then I'm not telling the truth. So that's another thing I want to write about. It's nature informed healthcare. It's like, do you pay attention to the seasons? Can you tell when fall's coming? Can you tell when summer's about to arrive? And how does that manifest in you? Like in Baltimore, it's like, oh, it's getting cold. It's fall. Winter's going to come in 2 months. Oh, it's going to snow and get cold. I'm like, you're stressing already, and it's 2 months before winter. Just because the air turned to 62 degrees, you're going to suffer for 2 months with the anxiety of winter coming because it turned not 95 degrees. And that is the stress that you put on yourself. You don't need that.
Yeah.
Well, I want to offer this to you, is that in the study I did with children, it wasn't just acupuncture. I actually had the patients do things with it. And that actually proved to be quite fruitful. And so I taught them a sort of a modified sort of acupressure procedure that they could do with it. The more I got people involved with their healthcare or the healthcare of their loved one, the better both people became. So I call it the power of personal touch. If you really concentrate and your heart is in your touch, not distracted by day, not distracted by upset with your child, not distracted with exhaustion, but really present. If you practice being, you'll relax. When you touch somebody, they'll relax. And when you work on those sorts of principles, you can change your dynamic in a relationship, even with a difficult child. So I call it power purposeful.
Okay. Are there any new research or methods that you're excited about or trying out or even researching?
Um, well, I mean, a lot of research I'm doing, I've done for 20 years actually, is defining stress. Where did the concept of stress come from? What does it mean? What causes it? What does it mean to each person? And that is a very individual conversation. There's a lot of research coming out because now people are funding it. Previous to the 1996, people didn't fund research into holistic medicine because everybody dismissed it. The chiropractors did a lot of their own funding, so they got a lot of research. But anybody else, we didn't have the money to run great studies and funds. But NIH opened up their Office of Alternative Health, which I think now it's integrated. NCCIH, I think, is their organization, and then they're funding a ton of research. And then, in the late '90s, Bravewell came on the scene, and they started funding research. And one of the first grants was here in Maryland, the University of Maryland, was an osteoarthritis study, and they came out quite positive. So there's a lot more research coming out. I think for me, after this amount of time, the most important part of it is getting people to realize the role they play in their health. I can't change what you do to yourself. I have 1 hour with you, maybe two a week. The rest of the 5 and 6 days a week, you have 24 hours with yourself. If you don't take care of yourself, I can't compare. Now, there are people who I've said that to, and I know that when they come in, they get temporary relief and they're satisfied with that. And I go, well, that's fine. If that's what you want to do, you can put my kid through college. I don't care. I would prefer that you get better. I would prefer that you don't develop these diseases. Crohn's disease was one of my patients had chronic Crohn's disease, and she was a chronic worrier and a lot of other things. And I'm like, you could make good choices for yourself, which would help reduce the impact on your bowels. But she'd come in with a packet full of chocolate. Like, yeah, wanted it. All right, well, okay, we'll work with it, but it was more when she would get too extreme, she'd come in, and ended up being more. I still see her every couple of months, or once a month, just to kind of take the stress out. To define it, it was usually a relationship and work. And it's like, well, as long as you are in that relationship and you keep working that job, you will keep coming to see me because you're not changing the things that you need to change to have a better relationship.
Yeah, I think it's the same with any kind of treatment, whether it's therapy or uh, medical or physical. It takes
Yeah,
both the patient and the doctor to make it work.
that's a great point, and we're finally in the Western medical model because I do work in a Western setting, one of them, and they're beginning to embrace trauma-informed healthcare, which is getting to know. It's very funny. It's after 18 years, we figured out that trauma-informed healthcare is important to the care of our clients. I'm like, well, 3,000 years ago, the Chinese figured that out, but you're right. It's new and it's good, but it really involves getting to know the patient's history. And I'm in a luxury position where I can sit and get to know. I don't have the same time constraints that other practitioners do, so I can listen to a patient and go like, well, this person had all this trauma, which is leading to their bad behavior in the facility. Like they're not a cranky person. They've been wounded and hurt so much they don't trust anybody. And then they send me in to help de-stress the person, and I'm like, got to figure out where the stress is coming from. Well, all the wounds are there. No one's addressed them. They've never mentioned them. They open up to me, and then they start to change. When they change, people go like, "Oh yeah, it's just, you're catering to her." I'm like, no, I'm listening. I'm listening to it. And that's the one thing we don't do. We don't have time built in for our practitioners to listen. And then that can't change the behavior of the patient because well, here, take this. We're trained to think that if we take this, it'll make us better. And all it really does is stop our reactions. If you look at the meds,
Yeah.
they block the reactions. They don't teach you how not to have the reaction or how to get out of the situation that causes the reaction. If that makes any sense.
Yeah. And I'm glad people, doctor like yourselves are incorporating holistic practice or wellness, because I think I'm noticing that even when I'm talking to other medical professionals, or even it's a multifaceted issue most of the time. And if you're not looking at it from a holistic point, you're just treating, small symptoms and not the whole thing.
Well, you're right. You're absolutely right. And the big issue is, if a person comes into a doctor, do they have time to really understand the whole history? I get notes and I read the patient's chart when they come into our rehab facility, and there is nothing beyond the injury of the bone. There's nothing before that. So I don't know how many other conditions they have that might be influencing the pain. Then the patient starts talking to me and all this stuff starts to come out. And I'm like, how is that not in any of the notes? And it's not there because Western medicine's vision at the moment, for the most part, is what are they in here for now? They don't really care how it evolved. They have diabetes. Okay, we got to get this thing under control. We've got to give them, lower their A1C. Here's the medicine that does it. It's like, well, stress causes an increase in certain hormones, which lead to an elevated A1C. Are you asking what is their stress in life? And the answer is usually no. And it's like, well, then all you're doing is put a Band-Aid on it, lowering the A1C. The body's still experiencing the stress, but it's not coming out as a reaction. So it's going to go someplace else. They'll develop another problem. So then they'll develop heart disease or ulcers or something else. And holistic medicine really believes that the body tries to contain negative energy in a way in which it's not going to kill you. So it doesn't go to your heart first. It takes 20 years to get to your heart. It may start in your stomach with upset stomachs and ulcers or Crohn's disease or this or that. And then eventually, if you don't care for it, or you constantly are in that environment and taking medicines, people, oh, my blood pressure is fine. Are you on medicine? Yes. Then your blood pressure is not fine. You are controlling it. There's a difference. Does that make?
Yeah.
Yeah, it's like, no, here, this medicine's doing what you should be doing for yourself. But you're still doing the bad things you're doing for yourself. And you will have a heart attack if you keep going. So it seems like a foreign concept to many people because we've trained them that way. The Western models trained them that way.
Yeah. Are there things you feel like, whether it's process or intake, or things that you feel like needs to change in the medical industry?
Well, I mean, I've often said this, and it's difficult because obviously I'm in the practice too. It's as soon as we make healthcare a business, you have an inherent problem because every business's costs go up, which means that they have to raise their prices. So if we want universal healthcare or something else, we have to actually give education for free to people who want to be doctors so they don't come out with debt. And then we need to get to a system where they make a living, but they're not benefiting from all the excessive charges and overseeing of patients. And then we have to develop a system which actually pays attention to people's needs. It combines behavioral science and Western medicine. And that's the whole nature of trauma-informed care, is it's trying to push the behavioral sciences are trying to push the physical medicine to recognize the conversation of behind this disease is a trauma. And let's deal with that. And then if that reaction to the trauma goes away, we will not have the same choices that the person makes. And that would be a much better way. It's very time consuming. It would be very expensive. And you have to get people who don't want to just come in and work and leave with patients. And that's a big problem because people look at it as an industry. I'm going to be a nursing tech and I'm going to be a nurse. I'm going to be, and I'm going to go and do this and go home. As long as you look at it that way, you might as well be a factory worker because you're not taking the time and you're not given the time to sit and listen to each patient. They don't put enough nurses on the floor. It would cost a fortune. So the biggest problem is it being a business. And the biggest problem for me is it's a business because I choose to take time away from my benefit financially to give time to the clients because I want to know. I really want to know what's going on. And, it's difficult because it's time management. If you've been to a doctor's office, you see them all queued up and you see them every 15 minutes, you know what I'm talking about.
Yeah.
Yeah, because they only get paid for that 15 minutes. They don't get paid to sit and talk. And
Yeah.
that's the insurance company. So it's a complex situation.
Yeah. Thank you for giving me perspective on that because it's not really pointing fingers. I just like
No, no.
perspective from,
They're guilty of, the only thing they're guilty of is being involved in a system which has evolved to its own benefit,
Mhm.
right? It's self-reinforcing. And the problem is, how do you get out of something that's self-reinforcing? Every single one of them, like I knew friends who are like, oh, pharmaceutical companies are, well, no, your neighbor works in a pharmaceutical company. They're not out trying to hurt people.
Mhm.
They really think they're trying to help people. So, there are cases where that's not true. That was opioids, but by and large, people are legitimately trying to help people, but their perspective and approach is not necessarily the best. And it could be modified with looking at things from more angles.
Mm.
And some people don't want them. Some people just want to take the pill and go home. So you can't change. You got to change society. Good luck on that one. that's a longer conversation.
Yeah.
Change people to think that taking care of themselves is a good gift rather than doing all the horrible things they do to themselves. I've done it. I mean, you know, I do it. I every once in a while. This morning, I went out and had a coffee and a donut before church. It's like, I know better, but I limit the number of times that I do it now. I don't do it every day. I do it like on Sunday when I can repent for it and be done. Oh.
Is there anything you want to leave the listeners with before we close it out?
Well, yeah. I mean, listen early on and trust your body. Don't go to someone and then they say, "Oh, there's nothing wrong with you." That's number one. If you know you don't feel right, you're probably correct. And it may be before anything has developed. So keep pursuing it, but also look at what you're doing and figure out what may be causing it. Like, are you overworking? Are you not taking care of yourself in some other way? And then the next piece of it is just realize that, and maybe it's because I'm 65 now, but your life is X amount of time. Don't you want to have a rich, warm, healthy life rather than come up with problems when you're 60, 70 and think it's inevitable? It's not. You can live for a very long time without any conditions if you choose to take care of yourself. And that means changing some, habits that you may be attached to. Drinking. I did that in college. I mean, we all did, or some of us did. Staying up too late, eating the wrong foods. It's like, okay, take some discipline to live a healthy life. And that's what most of us struggle with.
And if anybody listening wants more information, I'll have it in the description.
Okay.
If you want to be on the podcast, you can email americangypsy@gmail.com. Thank you for listening. And thank you, Dr. Paton, uh, for your time. Thank you for listening. Peace.